The United States spends twice as much per person on health care than other developed countries, yet we're less healthy. Okay, so well, our next guests are two of the founding partners of Primary Care for America, a new collaboration of experts working to shift the conversation a bit, and with that education of folks and prioritizing the high quality primary care that everybody wants and needs. So let's welcome Sean Martin, Executive Vice President and CEO of the American Academy of Family Physicians, and Dr. Rashika, the Chief Innovation Officer of One Medical. So, Doctor, let's start with you. What is the main role of a primary care team, and why should we all have one?
So Barbara Starfield was one of my mentors and was a health policy professor at Johns Hopkins, talked about the 4 C's that define primary care. So it's comprehensive. It's a doctor who can help look at your whole person, not at just a part of you. It's continuous. It's based on a long-term relationship, not a different person each time, someone who really gets to know you. It's first contact. It's the place you can go, the first place you can go for any problem you may have. And finally, it's coordination. It helps you coordinate the whole rest of the healthcare system. So why do we need this? Well, health is really complicated, and our healthcare system is maybe even more complicated. And as an individual, as a family, you really need someone who's on your side, who can help you improve your health, find things early, navigate the system, and that's what primary care does when it does well.
Okay, and Mr. Martin, studies show the U.S. spends twice as much per person on health care than other developed countries, yet we're less healthy. Why is that? How can we change that?
Well, we know that individuals that have ongoing relationships with a primary care physician or a primary care team tend to have better health outcomes and live healthier lives than those who do not. So understanding this, we need to prioritize primary care and access to affordable primary care for more individuals and more families. And then we need to prioritize the mental and physical well-being of patients across their lifetime versus just focusing on them when they are sick.
And doctor, why should patients get involved to influence change when it comes to funding for primary care?
So, our health is really important. The health of our family is really important. And our current broken healthcare system really means that patients are vulnerable to chronic diseases, to preventable issues, to not being able to get the care they want or need. And a healthcare system that prioritizes primary care will allow all of us to better tackle whatever nature happens to throw in our way, particularly as we get older. So I've had the privilege to start and run what's called an advanced primary care practice. We were able to convince payers to do exactly what we're advocating we need to be doing for everyone, which is investing significantly more in primary care, doubling down on it, allowing us to spend more time with patients, allowing us to give them a robust team to help them with their health and better technology. And what we've seen over about a decade is this can dramatically improve patients' experience. It can really lower the cost of care by preventing hospitalizations and ER visits by actually making people healthier. And that's what the country needs.
Yeah, very good. And, as we look at this whole picture, we do need change. And Mr. Martin, can you share how patients can get involved to influence that change?
Sure. So each of us as individuals need to communicate with our employers, with our elected officials, and with other individuals that have influence over healthcare choices and healthcare policy in the country to express how much we value primary care and that they should prioritize primary care in our healthcare system for the reasons that we've outlined today. Primary care is the only type of care that has been demonstrated to improve health outcomes for individuals and also reduce healthcare costs.
Okay, thank you both so much for all this good information here. And where can we go for more information?
Sure, everyone can visit primarycareforamerica.org to learn more about what is possible when we invest in primary care.
Okay, thanks once again. And of course, you can check out our website as well, and that is firstcoastliving.net.